Hi, I'm Dr. Dalila Lewis, and it is my great honor and privilege to serve as the Residency Program Director for the Child Neurology Residency at the Medical University of South Carolina here in lovely Charleston, South Carolina. While it is my great regret that we are not able to perform this interview process in person, I am glad to be able to offer at least a snippet of a welcome and introduction to our program via an electronic platform. Our inpatient experience is solely here at the Shawn Jenkins Children's Hospital, which is a newly opened state-of-the-art premier facility. And our admissions primarily occur on the 9th floor for the Pediatric Epilepsy Monitoring Unit, but we consult throughout the hospital. On the outpatient side, we have two main locations. The main one is the Summey Medical Pavilion, which is in North Charleston. And then we have another clinic in one of the suburbs in Mount Pleasant. And then we also have the ability to provide clinical experiences at some of the outlying regions.
So the Pediatric Neurology Residency program is a 5-year program which involves 2 years of training in general pediatrics and 3 years of child neurology. The biggest advantage is that MUSC is one of the biggest tertiary centers in the state of South Carolina, so we see everything. We see the bread and butter cases, we see the most complex cases, and I think that's what is really fascinating about this program and one of the strongest points of this program.
Your first 2 years, you're part of the categorical pediatric program, and it's really wonderful because here you feel like you're part of the peds residency. I made some of my lifelong friends here, and then in your third and your fourth year, you split up your adult neurology time, 6 months in your third year, 6 months in your fourth year, and then the rest of your time is spent as a pediatric neurology resident. We're kind of a small to medium-sized program. You have a lot of independence to kind of make the program what you want, whether they're epilepsy or stroke or neurocritical care. You can kind of lead your way to that path, and you have support from faculty, from your colleagues, from everyone along the way to make what you want out of the program.
The clinical experience is extremely broad. We have specialty in the area of epilepsy, and the other area that we focus on is headache and also cerebral palsy. We see a tremendous number of movement disorders, demyelinating disease, structural abnormalities, tumors, so there's a huge diversity.
Ketogenic diet is a well-known modality of treatment of epilepsy, and we are very lucky to have a great dietitian with a great experience in ketogenic diet. She is running a clinic and seeing patients here at MUSC, as well as extending her service to Greenville, South Carolina.
I think our residents get a really good insight into ketogenic diet therapy that they might not get otherwise. We work very closely with all the physicians and residents. Lots of education, lots of availability to ask questions, and therefore when they go off to further their training or get their first jobs, they're really prepared to be able to understand and explain keto to their patients.
The facilities are amazing. The program was great even before the facilities opened up, because they both opened up within the last year. But it's made coming to work pleasure. And it also is incredible for our patients.
Every room here has a view of the ocean, the harbor. Everything is state of the art.
It's a stunning view. I think patients, when they get a room here, they automatically recovers.
People here make the program. And I'm not just talking about the faculty and the staff and the residents, but I'm talking about the whole infrastructure support, administration, and actually most importantly, the patients.
I think this job and anyone who goes into peds, you just are very fulfilled doing the work you do. It's trying and it's challenging, but there's so many patients that have come in such critical condition, and you see them and their families going through so much, but then you see them, like walk out of the ICU or ride a bike out of the ICU, and it's just the greatest feeling ever. And it's definitely would not be possible without our entire care team. So the ability of the care teams here to work together, dietitians, pharmacists, therapists, everybody, residents, med students, everybody contributes something.
So I thank you for your interest in our program. I hope that you have enjoyed this video. We have attempted to capture the best of us. Certainly would welcome your interest and your feedback. Please reach out to me via email. I do thank you for your interest in our program, and we hope to see you in Charleston sometime soon.